Welcome, folks. Pleasure to see some new names and some familiar names on Zoom. I know we'll have a couple more folks trickle in, but we'll go ahead and get started with introducing folks to our speakers. But first, just hopefully all of you landed here because you're here for the Tobacco Research Program's monthly seminar. I'm Dana Carroll. I'm an associate professor in the School of Public Health and a faculty member pretty involved with the tobacco research programs. And I'll let my co-chair introduce herself.
Hi, I'm Alexandra Alcheva, and I'm a postdoctoral fellow with the Institute of Global Cancer Prevention research led by Dr. Stepanov.
And we're just thrilled to have you here today. Hopefully, everyone is staying warm. We've got some snow in the city, and it sounds like some of our folks up in Duluth have a little bit there too. And hard to believe too that this is the last month of 2024. And we have a perfect presentation and speakers in store for you to wrap up this year. I'm pleased to announce that, as you see here, the Association for Nonsmokers, Minnesota, has agreed to join us. And I have known about their work over the past several years and the impact and really the action that they do around tobacco prevention and control. Because we have a group of speakers, I just wanted to share a little bit about the organization, although I'm sure this will come through in their presentation today. This Association for Nonsmokers of Minnesota, I just really resonated with their core commitments to protect young Minnesotans from a lifetime of addiction, to ensure that all Minnesotans can breathe clean, smoke-free air everywhere, and to reduce health inequities and other disparities in relation to commercial tobacco, nicotine, and other drugs. And so we have about 5 or 6 speakers that are joining us today, just coming here with a wealth of knowledge about the real-world impact of this work. And with that, we're going to start off with the president, Jeannie. So Jeannie, go ahead and take it over.
Thank you very much. And it's wonderful to be here. We've had partnerships with many researchers from the University of Minnesota and other places in the past, and we would like to continue building partnerships and working with people. So we're very eager to share who we are and what we do. ANSR was actually founded in 1973, and we were such a small organization that we sort of realized that we needed to do things differently if we were going to make a difference. And right from the beginning, we started working on policy. We didn't exactly know what we were doing back then, but we had some guidance from former legislators who gave us some direction. And our first big win was in 1975 when the Minnesota Clean Indoor Air Act first passed. That was landmark. It preceded the science of secondhand smoke. And I remember saying myself and hearing others say that we would never have science on secondhand smoke, that it was just too complex an area to be studied and get good information on. But we did get good information. And the work that we did in the 70s would not stand up to scientific scrutiny today because we sort of lived under the belief that you could separate people a few feet away from each other and smoke wouldn't cause a problem. Well, we now know that that isn't true. We know it's not true in public places. We know it's not true in apartment buildings and in multi-unit housing. So the science has guided our work and will continue to guide our work as we go forward. We put heavy energy at this point in our organization into point of sale work, and you'll hear a bit about that and some of the research we've partnered on with that. Smoke-free multi-unit housing is a big area of concern. And as with so many things, we made a good deal of progress on secondhand tobacco smoke and dealing with that in multi-unit housing. And then came cannabis, and the whole thing has been a bit set on its head. So there's a whole new area of work that relates to smoke, that relates to cannabis. And then tobacco pricing is another area. We also have programming that deals with technical assistance on alcohol, tobacco, and other drugs. And you'll be hearing about that from Madeline. So with that, I'll tell you that the thing you're seeing on your screen, go back one Emily, there we go. We created this history of tobacco control. ANSR figures prominently in it. Others had many, many things to do, and we mentioned them, but this is kind of the work that ANSR has been involved in going back over time. And we're not going to go over all this, but we will provide the slides to you if you want to just kind of look at the history of tobacco control as it has evolved in Minnesota. So, Emily, I turn it over to you.
I turn it to Katie. We didn't practice as much as we said we were going to. There you go, Katie.
afternoon,
Introduce yourself
everybody.
and yes.
Yeah. My name is Katie Engman. I'm a program director here. I've been here 20 plus years and have been able to see the evolution of our policy work. And it still continues to be an issue today. So I just want to kind of ground us in this presentation about some of you may have seen this with COVID, but we developed it with commercial tobacco. And we know that all of these strategies, from smoke-free environments to trusted adults to availability and accessibility and exposure to secondhand smoke, all of these things are layers of the Swiss cheese, help prevent a lifetime of addiction, help people quit, and also help young people never start. So there is unfortunately not one magic slice that does all this work, but we really believe in this layered approach. All right. Emily, right back over to you.
Yeah. And this is just our kind of our lead in into everything we're going to discuss here. Like the basis of our top talk today is about how we at ANSR use research to really push policy change. And you can see from this slide, like research isn't a one-time thing for us. It's a multiple steps along this road to policy change. Research needs to be inserted into the conversation. So pre-policy or researching and gathering data from all sorts of external sources, as well as doing some of our own research, researching while we're building coalition to know who are the folks that are impacted, who do we need at the table, researching and developing talking points that resonate with decision makers and with advocates, and using those statistics but translating them, and then finally doing our research at the end post assessment to know what the impact was and how we can tweak and improve policies to have the most impact and be the most politically palatable sometimes too. So this is kind of the umbrella that will now break down into various policies that we work on, as Jeannie mentioned at the beginning, everything from smoke-free indoor housing to point-of-sale policy change to alcohol, tobacco, and other drug prevention. So we consider ourselves an advocacy organization, and things that play into that are certainly research, but we have this goal of advocacy to interact and engage with our community, to educate people about issues, and really to achieve that lasting results. All those pieces need to come together in order to have that policy that can impact many. Our main goals over the year, and certainly more right now, have been focused on flavored commercial tobacco restrictions in Minnesota, but we also have initiatives that work on pricing, that work on coupon restrictions, really focused heavily on health disparities, because we know the industry is focused on targeting a certain racial and ethnic groups. So we likewise have to work on the equity end of things. And then also, as Madeline will get to later in the presentation, just that general prevention work around alcohol, tobacco, and other drugs. So I will turn it over to my colleague Molly, who will talk about one of our projects that's very firmly rooted in research and kind of what that has yielded us over the years. And I think this is going to be some fun slides for you all to look at. So Molly, take it away with Project Watch.
Awesome. Thanks, Emily. I'm Molly Schmidtke. I'm a policy and technical assistance manager here at ANSR, and I've been on staff for almost 5 years now. And I've been working on Project Watch. So let's get into it. So a little bit about Project Watch. So Project Watch stands for Working Against Tobacco Companies' Harm, has been working to decrease commercial tobacco industry influence in Minnesota since 2010. The program is currently funded through a grant from Blue Cross Blue Shield Center for Racial and Health Equity, and was previously funded by Clearway, Minnesota. So Project Watch focuses on identifying and tracking commercial tobacco industry marketing tactics, such as price promotions, contests, product launches, rebranding, so many different initiatives that happen all the time with industry. So this program also focuses on educating city, county, state, and school decision makers about commercial tobacco control best practices and providing technical assistance to commercial tobacco control partners across the state. So since 2010, Project Watch has collected over 10,000 commercial tobacco industry direct mail marketing pieces and more than 36,000 industry emails as well. And this information is presented locally, nationally, through in-person presentations, conferences, webinars like this, and a quarterly newsletter. So there's really been an evolution in Project Watch, back in 2010 to where we are now, almost 2025. This huge shift in these direct mail promotions to email promotions, item giveaways versus, cash prizes now as giveaway gifts for subscribers. And then this rise in social media influences and starting to kind of look at that and see how all of that is impacting tobacco industry influence. And a little bit of background with this too, we have this collection. Where are we collecting this from? We have data collectors all over that have subscribed to industry newsletters, industry mailings. And so they get mail, they send their mail to me, and we work to code it correctly and look at trends from industry. So we're looking all the time, monthly, on, where are things changing? What are we seeing? Differences in previous, trends, what's coming. So able to kind of look at that and track that too. Next slide, please. Perfect. So I just wanted to share a couple of examples of what Project Watch looks like. So this example, this is a direct mail piece I received back in September of this year. American Spirit promoting their Sky product. This is one of their most recent mailer pieces. The whole design is pretty sleek. You open up the top flap there and it looks like you're opening up a pack of cigarettes. So they continue to, put a lot of money into those marketing initiatives and what's being mailed out to folks. And there were over $8 worth of price discounts within this specific mailer alone. So a lot of coupons, discounts, lowering prices happening too. Like I said, this direct mail, so the $5 there, plus then the scan on the QR code to watch a video, you get $3 off. So really just shows, that continued piece to subscribers, really trying to get into the eco-friendliness and really promoting that. That's always kind of been American Spirit's brand, but they continue to push that. Farm to pack, that makes me think farm to table, talking a lot about charcoal filters and coconut shells, it being derived from coconut shells. So just really continuing to push this conversation from American Spirit. I also wanted to share some email examples because sometimes they look pretty different, emails versus some of the mailers. Grizzly recently launched their oral nicotine pouch product this past spring. So it's relatively new for this company. And just wanted to share some of the emails that our subscribers have gotten, talking about say goodbye to pouch shame and a lot of very big kind of gender roles and even misogyny being pushed within some of these mailers as our emails as well, just around manliness and using a nicotine product. So very interesting there too. Another example too, we're subscribed at wholesale websites. So the last couple I've showed are around, individual brands and companies. This is a wholesale website that sells a wide range of products, from Geek Bar to 50 Bar, Off Stamp, so many more, and more than just vapes as well. They sell THC products, they sell oral nicotine products. So we see this as well as big promotions happening through wholesale websites. I wanted to share one more here on the email examples of oral nicotine products. This was from last year around the holiday season. Oral nicotine products like Zyn and Lucy really gearing up for the holiday season, saying their products are great stocking stuffers for those who celebrate Christmas, perfect for a first timer or a nicotine enthusiast. So we continue to see this kind of marketing, and it's important to watch and be able to share this information out. And I talked a little bit too. We won't play the videos just for time purposes, but you'll have the slides. These are just a couple of TikToks of things that you can kind of see easily on social media. So it might not be a specific brand social media page that's promoting a product, but all of these kind of one-off accounts that continue just to promote nicotine product use generally. The first one, she's dedicated to reviewing nicotine product vapes. She tries a new one every day kind of thing, or every week. The other one is just kind of like a sleek design of like, oh, watch me unpackage my geek bar. And then the screenshot there on the very right is from that comment section. And the first comment that comes up is step 1, get someone to buy me one. Like, so showing that they are not, of age to even be able to purchase some of these products, and continuing to see this kind of marketing online. Next slide. Perfect. Thanks, Emily. Another social media piece too is following some of these specific brands. So that obviously is a little bit more organic social media content. This is very specific, looking at a very specific brand and seeing what they're posting. For example, Loon, a Minnesota vape company, they hosted their 2nd annual turkey giveaway for Thanksgiving. They continued to post all about it on social media, about turkey donations and where you can go to get product, or to get these turkeys, and just continuing to kind of share philanthropic pieces, even though the harms that these products are causing to community are very much, ways much higher than any kind of philanthropic work that they might kind of be portraying. So continuing to follow these types of things as well. Tracking rebranding, this is so important. Brands are always putting out new labels, trying to become sleek, trying to become in. So for example, that's their old logo. They recently rebranded to this new kind of matte color, very much in, and aligns a lot with, their biggest competitors in. So a lot happening there, and continuing to follow that. And then we're always tracking, what's popular, what's coming out when it comes to nicotine products generally. I have a couple examples here. Highlight Vape, they look exactly like a highlighter marker. Geek Bars, you can play video games on them. Elf Bar / EB Creates, they've continued to be popular. They also sell THC products. So really a lot there. Lost Mary, Lost Vape, again, these kind of high nicotine levels and games that you can play. And then Loon, Minnesota. So Loon and Men, that local company here. Also wanted to just quick touch on popular and emerging oral nicotine products. This is still a relatively new space. Over the last few years, these have really started to emerge, but we know, Zyn is really kind of at the front of the market right now, but there's also Velo, there's Lucy on all of these products. And I will pass it over back to Emily.
Yeah. So all that great research that Molly and her team are collecting, and that we've been collecting for almost a decade, what do we do with that information? It's one thing, it's always interesting and exciting, but we want to take it kind of to the next level of how do we use that information to impact policy change. So I want to talk just about a few of the local point of sale ordinances that around flavors and around price that we've worked on recently, and how we weave in research to that work. So first, just kind of briefly, flavors. Flavors is the name of the game for the industry. It's been for the past many years kind of one of our main focuses, is how do we reduce the appeal of these products to young people? And the number one thing really is flavors. So flavors, age, and price all work together And if we can tackle those things, we can really get at youth initiation. But the flavors are so egregious and so wide ranging that that's really been a heavy lift for us. You can see on the screen here just the range of products that mirror some of what Molly just showed you too. But any product you can think of comes in a sweet candy flavor, besides cigarettes, of course, which only come in menthol. Um, but the cigars, the vape products, the chew products, the oral nicotine products come in a wide range of flavors, many of them like egregiously kid friendly. You can see Candy King brand on the side comes in Sour Patch Kids and Jolly Ranchers and cereal flavors and cotton candy. So we know exactly who these products are getting at. And the research is there. We have local research on why flavors. We have national research from CDC on the high percentage of youth who use these products use flavor products. We have more research from the federal level about how the majority of youth who use e-cigarettes are using flavored products. And then we have state level data from the Minnesota Youth Tobacco Survey and the Minnesota Student Survey that just confirm these things. So no shortage of research and data, whether that's from our own research or a state level or federal organization that really draws that straight line between these flavored products and higher youth use rates. So what do we do with that?
Yeah.
Yeah.
Something happened to your screen. Are we back to okay?
Can you see the map?
Now we can see the map. Okay, you're good.
Okay.
Keep going.
Okay, thanks. So what we do with that information is really work currently at the local level across the state, going city by city, sometimes county level, and talking to decision makers, building up support among community members about we got to do something about these flavors because all of the research points in the direction of this being the issue among young people. So we started about a decade ago in Minneapolis and St. Paul. Working on local flavor ordinances, working with city council, working with coalition members to pass first. You know, we didn't know right out the gate exactly what would work best. And in both Minneapolis and St. Paul, we passed restrictions on the sales of these products. And we didn't even start with menthol cigarettes. We tackled that second because it was such a heavy lift. We started with the fruit and candy flavored products. In those two big cities, we restricted those products to adult-only tobacco shops with the rationale that getting these out of the sight and mind of kids would help. We added menthol a little bit later, but since then, we've really learned kind of what the unintended consequences of just doing a restriction are. And since about 5 or so years ago, most of the communities we work with do full ending the sale of all flavored products everywhere throughout their jurisdiction. You can see on the screen here the cities with darker green circles have full on ending the sale of these products. And again, that's now shown a trend, and we can show people the impact of these policies because of the research that we do, and show them the unintended consequences that have happened in communities that haven't done a full restriction. So we're at about 26% of the state of Minnesota covered by a flavored tobacco policy. Most of our policies throughout history have gone local first and state second. We are trying our darndest to also address flavors at the state level. We've had bills at the legislature for the last several years, and it's just a slower game. We have not had success there yet. We've made progress, but we continue to tick away at the local level, knowing that if we can help and protect some people, we can build upon that and eventually get to a state level policy. So stay tuned for more on flavors, but that will continue to be the name of the game, and we continue to do that work. I want to talk a little bit about one of our pricing policies, and we've done this now in a few cities, but St. Paul was the first. Back in 2020, we worked with the city of St. Paul to end the redemption of tobacco coupons and price promotions and to set a minimum price for cigarettes and chewing tobacco. You saw some of those coupons that Molly showed you from Natural American Spirit. Those are prolific. Those are everywhere, both mobile and mailed coupons. Tobacco users report getting those and using them on a regular basis. You also see in-store promotions like buy one, get one free, buy one, get one half off. And again, these are ubiquitous. So we really wanted to address that because we know that price is a driving factor for youth initiation as well as folks who are wanting to quit. So the proposed ordinance would set that minimum price at $10 for cigarettes and chew, like I mentioned, and then end all the redemption of price promotions. Any coupons couldn't have an in-store promotion on any tobacco product, whether that's a vape product, a cigarette, cigar, or chewing tobacco. St. Paul, after lots of work by advocates and quite a bit of time, and in the middle of COVID, took the plunge and passed that ordinance and became, if not the most, one of the most progressive tobacco control policies in the country with that move. We knew because they were first that research would be very, very important. We assessed every single store in St. Paul, or over 100 stores in St. Paul, pre and post implementation of this policy to check, were they selling products for under $10? Were they redeeming coupons? And what would happen once the ordinance went into effect? You can see here some of the data that before the policy, the vast majority of stores were selling cigarettes for under $10 in the blue here on the left. Post implementation, less than 2% were selling under $10. So that ordinance really had an impact immediately on the price. We saw similar impact with the redemption of coupons. That pre-policy, 41 stores were redeeming coupons, and after, almost all of the stores were not redeeming coupons anymore. So again, a nice immediate impact on those price promotions. And one of the fun, we still love to talk about it being unanticipated consequences of this was that tobacco ads largely, exterior tobacco ads largely disappeared after this ordinance went into effect. You can see here pre-implementation, some of the exterior ads all advertise price promotions. You'll get $2 off when you buy 2 Grizzly, get $1.36 off 2 packs of Marlboros. If those price promotions are no longer allowed, that advertising comes down. And now most of the exterior tobacco advertising in St. Paul looks like this, merely stating the price of the product rather than promoting a special price or discount. So we wouldn't have known this without the research. I think we would have seen it anecdotally, but now we have the numbers to show and can use that story to go to other communities. Minneapolis passed the same policy in April of this year. So we're making progress, and we'll continue to use the St. Paul data to tell that story. Back to Molly and Katie for some how we use research in youth leadership in our work.
So we all know historically that our young people have been targeted. We know that, the research has showed us that if you don't start before a certain age, you're most likely never going to start. So one of our big pieces is really involving all communities, but I'm going to talk a little bit about our engagement of our young people in our community. We have a student group in Ramsey County that is called our Student Action Team, and their goals are really to end the sale of commercial tobacco or flavored commercial tobacco products, look at access and appeal within their communities, and then educate their peers around the predatory marketing and greenwashing and that they see. One thing I will note is that our students, the health piece is like kind of secondary in our discussion. It's really about the industry and holding the industry accountable. We do not have a punitive lens at all. And the punitive lens actually goes back to the industry. So our students, here's a couple pictures. Our students have done Take Down Tobacco Day at their school. They've done some national podcasts. They've done peer education. They've been at the Capitol. They've been all over. And really, these are young or youth ambassadors for their peers and also to communicate to decision makers. If you're at a Capitol or if you're in a research or you're sitting in an office, you have no idea what it's like in that building. And so their goal and their job as young people is to share their stories, share what they see every day, share what their peers are seeing and feeling, share what they see on social media. That social media is very targeted. We could live in the same zip code and even in the same house, and I get some ads and my kids get different ads. So their job is to share that. Next slide. Here's a piece of a campaign that some of our students did for one of the high schools. Again, we're not about hanging posters in the bathroom and that's it. It was really a multifaceted approach, or that Swiss cheese model. We had students design some posters. We had them put some quick kits out in the bathrooms during select periods. And then they were able to reshape what their support program looks like if young people are vaping or using commercial tobacco in school grounds or in the building. So it was a comprehensive kind of circle approach to looking at what are they seeing in the district. Molly?
Find my unmute. Here we go. Wanted to also talk about some of the survey work that some of these students have done in the past as well, through youth group work here. So back kind of at the beginning of the COVID-19 pandemic, and then kind of during that beginning piece, through those first year or so, students, we weren't meeting regularly anymore. Students were at home. We were all at home, a little bit more isolated. We felt that, we understood that. They wanted to kind of see where their peers were at with things. They wanted to look at perceptions of vaping during the stay-at-home orders during COVID-19. So that was kind of that initial piece of looking at it. So they did some convenience surveying, created a survey. Able to get it approved through our funders, and they shared this survey on online platforms, so Snapchat, Instagram, text even to people. So just we felt like that was a good route to go, and we really found that to be true. Young people are the best messengers, especially to their peers. We could have never gotten the response as adults in this space compared to what our young people were able to do and collect, which was really amazing to see all the work that they put into this. So ultimately, there ended up being 3 total surveys. One was done in the spring, one was done in the summer, and then one was done in the fall. And the fall really actually did have a big adult push with it. And we saw the effects of that. We saw, some of the data that we found from that convenience survey just didn't quite look right. And especially when you're just looking at past things, other data sets, you could really tell that there was adult influence, or that it was being promoted in a classroom to take the survey rather than organically through peers. So it was really interesting. We were excited to do it. We're grateful to our funders, MDH and Ramsey County, for wanting to fund this work. And yeah, it was great to get our young people involved and learn more about what's going on with young people right now. It was some of that first research that we saw, and then some of that national and state research more formal national and state research that came out later really showed very similar things to what we were seeing. So it was great to be a part of that piece. Also wanted to talk about environmental impact. So we talk a lot. This is kind of one of our pillars of conversation when we talk about commercial tobacco prevention and, impacts. We know health impacts, we know mental health impacts, we know industry targeting, and we've really started to build up the environmental impact arm of this as well, and digging into the research. So looking at what is vape waste, really looking at what's in there, how are these things getting disposed of? Can they even be disposed? Half of these products, more than half, are labeled as disposable vapes. What does that mean? Right? So looking into all of those pieces, diving into the hazardous and chemical waste piece of it, the plastic waste issue of commercial tobacco products, and then the e-waste. So how does this really have that impact on environment?
There's something slides here. We found that this messaging on waste and environmental impact really resonated with our young people. The health impact, like I talked about, was like, yeah, whatever. We already know it's bad for us. You don't need to tell us. But this is something that they absolutely cared about. And from our surveys and our communications and our conversations with young people have led us to go down this path.
Yeah, absolutely. Perfect. So an example, kind of looking at that environmental impact piece, there was some research done in Canada actually on their menthol ban and what that environmental impact would be. And researchers were able to, apply that same method to the US to see what that impact could be if the United States decided to end the sale of menthol cigarettes. And it would have a huge environmental impact, right? We know that it would have a big impact on so many different pieces, and this is one of them. 1.7 million pounds of waste would not happen each year. That's huge. 3.8 billion cigarette butts. So that's just one product, right? So when we talk about that environmental piece, it's really important to kind of dig into that and see how that impacts so many different areas in our society. And around that, we needed to develop some materials. So we created a toolkit around environmental impacts. It can be found on our website. This is the screenshot of our website page. But there's fact sheets. There's a youth curriculum chapter, blog posts, sample letters, newsletter drop-ins, presentations. So a lot of different resources there to further that kind of educational piece on environmental impacts, and continuing to update as well.
And I will say, like, the environmental stuff is important now, and it will be important in the future. Right now, we're using it as another bucket of talking points to engage more folks. Like Katie said, some folks, as much as they know about the health impact, care more about the environmental impact. Great. We have a big tent come in and help us advocate for policies around flavors. Getting those products off the market is going to help the environment. But eventually, too, and we have been exploring for a year or so, how we can do a strictly straight up environmental policy. And we've had some conversations, partnerships with more environmentally focused groups. We bring the public health lens, but together we think that especially addressing the vaping products that are e-waste, lithium-ion batteries, hazardous chemicals, that can be a real push to focus on those products from a purely environmental lens as well, which obviously has public health impacts too. So shifting gears a little bit to our Live Smoke Free program. Jeannie mentioned this at the beginning. This is our smoke-free housing program that's been around for well over 10 years. And Live Smoke Free is one of our programs. And really this is focused on small P policy. So it works with property owners, managers, homeowners associations, supports residents, around creating smoke-free homes. These are multi-unit buildings, not single-family homes, where people share walls, share common areas, and share smoke, unfortunately. So we, for a long time, back in the early 2000s, were prompted by complaint calls from residents. Moms calling and crying that their kid had asthma and they couldn't get away from their neighbor's smoke. Folks complaining about moving into an apartment that just stunk of secondhand and thirdhand smoke. And so we were driven by those complaint calls to really conduct some real sciencey research. I would say this is some of our more sciencey research. I have a typo on this slide, but we started to study air movement in apartment buildings. How is air moving from one unit to the other? And with it, of course, the secondhand smoke. We also started to dig in legal questions. Can you actually tell somebody they can't smoke in their apartment building? And we surveyed renters and property managers to see, what are you experiencing? What would you like to have happen in your building? What are you doing right now? That sort of thing. And we learned so much that we were able to start to turn into some policy work in the early 2000s. We're very new and green at it, and we're some cutting edge things, but we continued to work up to direct policy work, to helping those buildings going smoke free, to helping others through technical assistance help buildings in their area go smoke free. And we just kept churning away at it. And really, we're eventually able to quote unquote write the book on smoke free housing with some federal funding. We wrote a manual called Developing a Smoke Free Multi-Unit Housing Program. This is used across the country to initiate smoke free housing programs in various states. When we were doing this, we knew about 50 smoke-free properties in our state of Minnesota. This was 2011 through 2012. We continued to do that direct policy work for the next 10 years, continued to build up our knowledge and our research around the importance of this work. And in 2021, we hit a milestone in Minnesota of 5,000 apartment buildings that are smoke-free. This includes 100% of public housing agencies, and Live Smoke Free program, had a hand in many, many of those. And then again, has really set a model for how to do this work, how to implement these policies. We've created model signage, and we've given out probably thousands of signs to properties so that they can let their folks know about their policies. So we continue to work on this. This continues to be a problem. As Jeannie mentioned at the beginning, the intersection now of cannabis smoke very much plays a role in this work, and figuring out how to tackle that takes, more research, more public knowledge shifts, more reaching out to decision makers to really get the broadest public health impact. So last but not least, Madeline, on to you.
Awesome. Thank you. Yes. I am going to talk a little bit about the Minnesota Prevention Resource Center, which is a program hosted by the Association for Nonsmokers Minnesota. You can go to the next slide. I am Madeline Brummel, and I work for the NPRC program at ANSR. So NPRC's work deals with the primary prevention of substance misuse more broadly, and we're also part of a broader substance misuse prevention network through the Minnesota Department of Human Services Behavioral Health Administration. So NPRC is one piece of that network, and we focus statewide on providing resources, training, convening, best practice, and technical assistance, and more. And then there's the other components of the network are on the slide here. We have SUMN, that is another statewide resource that compiles a lot of different sources of substance use related data for Minnesota, and makes it easily accessible for community members and coalitions. And then there's also the regional prevention coordinators. There's 8 of them located around the state. 2 of them are actually also housed in the ANSR office. I think there's a couple people on today. The regional prevention coordinators provide the one-on-one support side and tools for communities and coalitions that are doing substance misuse prevention. And then the fourth component of the system being the community members and experts and people all around the state that we serve. So yeah, NPRC is one component of the system, the resource side of that system. You can go to the next slide. So NPRC's work is focused on the primary prevention of substance misuse. Primary prevention meaning that we're really focusing on like preventing substance use before it starts, meaning that a lot of our audience and coalitions and populations are focused with youth and schools and young people, similar to a lot of ANSR's other work, but with less of a policy focus. NPRC's work in the is broad in the sense that it focuses on all substance use, so tobacco and alcohol and cannabis and other drugs as well. And then the primary prevention focus also means that we're thinking about like the risk and protective factors a lot of substance use, so mental health and adverse childhood experiences and positive childhood experiences a lot as well are like in the realm of a lot of our resources and work. You can go to the next slide. Yes, so NPRC is the resource wing of this network, and that basically is just meaning that our main goal is to connect best practice and research with community need in prevention work in Minnesota. So this looks like all the different things that are on this slide here. On our website, we have pieces of it with like stories about prevention work that's happening in Minnesota. We also host the annual Minnesota Prevention Program Sharing Conference, which is 2 days in October. And it usually has, 20 to 30 breakout sessions and 2 to 3 keynotes and like 30 exhibitors every year. We also host trainings and webinars throughout the year on best practices in prevention and topics of interest. Some of our like longer trainings, we have a few like in-person trainings that we host that are longer, that are 4-day trainings. Those come from SAMHSA at the federal level, and they have like basic prevention skills for people that are getting involved in coalitions doing prevention work around the state. We also have a pretty big resource library on our website that's always growing, but it's like a searchable collection of over 300 resources related to best practices of prevention. We have a newsletter that we send out every month, and then we also do technical assistance, and that is a way that we're creating new resources and trainings based on things that are directly related to what people are looking for around the state in prevention work. So just a little bit more about our resource library. It's a pretty large collection of resources, and the purpose is really being to support the development of best practices in prevention in Minnesota, and then spread and share helpful resources and tools. We have resources from the university in our library, and it's always growing, so we're always welcome to new tools being sent our way as you hear about them as well. And then the last slide here about NPRC is just a little bit about the technical assistance as well. This is kind of a dynamic piece of what we do because it's really just based on what people ask for. So some of our like most utilized resources that we have in our library now have been created because somebody submitted a technical assistance request to ask for them. So we just try to make sure that people know that that's available and promote that. And this is a process where we get to do like specific research on a topic or outreach to the people that have the information that's needed, and then share that out to the person that's looking for it, and also more broadly as well. So yeah, that's what I have about NPRC.
So that was a quick overview, and we do lots of other things and have the deep and broad history, but we're happy to talk further with anybody anytime, but just leave you with the point that we know that research is vital to all of our advocacy work. And this is Jeannie's plug for maybe some partnerships in the future. There's always more research to do. We're always coming up with different ideas on what could work and need that research to back it up. So I will leave it there with our contact information. And I think we have a few minutes for questions, but I'll turn it back to you, Dana.
Yeah, fantastic. Thank you so much. I appreciate the crash course that we got and all the efforts that you do. It's amazing just how far back you folks go. And, you know, Jeannie, as you were talking about cannabis, I was thinking, wow, but you guys have gone through this before with kind of figuring it out. And so it'll be great to see the efforts that and those lessons learned that you apply to cannabis use. So I have some questions, but I want to make sure our audience gets questions in. And so one was put forward by Andy Tan, and I think some of you folks have seen it, but just to reiterate, he is really interested in understanding, you know, both how you recruited, I believe it's the youth leaders, and then also if you can share if there are measures or approaches to evaluating their experiences. So thanks, Andy, for that question.
I can try to answer that. We recruited through some of our school and community partners. The students come from the 3 suburban districts in Ramsey County, and then we do have one high school group that is in the city of St. Paul. We should probably be doing more evaluation of pre and post and whatever else, but I'm happy to talk further about that and how do we measure that better. You know, just a quick summary of, we had this group and we had, I think we had like 27 students apply. We went through it and we thought that we would do some natural selection and they just wouldn't come back. And I'm like, oh, we'll be fine. We'll just keep all of them and they'll just weed themselves out. Well, they all kept coming back. So we must be doing something right to still have them all coming back. But I'm more than happy to talk offline about that.
Katie, don't sell yourself short on the evaluation piece, because as you'll recall, you just completed an evaluation of your group with Blue Cross. So maybe you can just describe that painful experience just a little bit.
With the Blue Cross, and I think your general point, like a lot of times our funders bring some of that evaluation and research as a requirement, but then if we're lucky, like Blue Cross will also support us in the evaluation piece of it. So they came in and did an in-person evaluation with Katie and Molly's youth group as part of that grant requirement. But it was their evaluators, which can be both painful and nice to have that.
I say painful because of the amount of effort involved in doing it. It took a lot of time, but probably was worth doing. And I think that we are getting some information in terms of what youth like about it and what keeps them coming back. But Katie, maybe you can just describe the process just a little bit in terms of what the evaluation entailed. Because this is a group of researchers who'd like to know.
I'm trying to dust off my cap. You know, I think what I struggled with on this, and this is awesome, is that, you know, the researchers thought they were going to fit in a box, and youth don't fit in a box. Young people don't fit in a box, and we have to be flexible in meeting them where they're at and their experiences. And one size approach doesn't fit all. So they were able to rate like how they felt, their involvement, how many times did they participate, you know, just by coming to the meetings. We call it an action opportunity. They have at least one, there's probably 3 or 4 a month that they can then do outside of meetings. How many times did they feel engaged? Did they feel heard? Were they able to use their voice in shaping policy? Many of them, we just had a win here in one of their cities where they were able to end the sale of flavored tobacco products. And one of our students said this was the best night ever. Like, I actually felt heard, and I was able to make change. So I will email you and we'll connect. Did I cover that, Jeannie?
Well, we'll see if there are other questions. You know, I would like you to describe your youth group just a little bit, because I think people are interested in that. Are you getting only students who are college bound and valedictorian students, or are you getting a cross sectionist? Who are you getting that are excited about doing this work?
I think, historically, I've been working with young people for the last 20 years and most of my career. And I would say that the majority of my kind of goal with working with young people is not the kids who are involved with everything. We know that prevention and a caring adult is huge. And the kids who are in 3 sports and NHS already have a whole bunch of coaches and whatever else that they can connect with. I would say many of our students aren't involved with everything. This may be their spot, and that where they feel connected, and this is their club or their sport. We have a diverse group of students, age, economic, gender, backgrounds of, and I would say the most of them would be middle to low income. Also, I would also add in here that we have students that are on what's the right way to say this, but like on the autism spectrum as well, that really, really want to be in this and want to feel part of something. So I think that's kind of who we have as our students, and we're really open to meeting our kids where they're at. Not every kid wants to speak, but they want to write or they want to design. And so we're able to pull their skills in and make this kind of complete package, or the Swiss cheese model, with all these different amazing skill sets.
Great. Great. Thank you so much for elaborating. And April, I see your face, not to put you on the spot, but I'm assuming
Yeah.
you have a question.
I do. I have a big question. I really appreciated your presentation and just like the history of your organization and all of your advocacy and research work. The question I have relates to how much work you've done in the shisha or water pipe space, especially as it relates to multi-unit housing. I'm doing a project right now engaged with the Somali community and learning about how enforcement is really a huge challenge in multi-unit housing when it comes to water pipe use. And I'm just really curious if you've learned anything about this, or maybe we could partner on a solution.
Our
Yeah.
strongest people on housing aren't on this call, but our strongest person on hookah is. So I'm going to lateral us to the strongest person on hookah. Emily?
I'll try my best. I will defer to also another person that's not on the call. We have actually an East African community organizer named Saeed Ahmed, who we've been working with for the past 2 or 3 years. And my lens on it is the point of sale policy flavors piece, and really wanting to ensure that hookah and shisha tobacco are not excluded from any flavor policy that we get passed either at the local or state level. And so far we've been successful in that in Minnesota. The conversation has come up at the state level, and that is a deal breaker for us. We refuse to have a community negatively impacted to get the whole rest of the package. So we knew that we had to get ahead of the game, and we started working with Saeed, like I said, 2 or 3 years ago. And his role is really to engage the East African community broadly across mostly the metro on the health impacts of hookah use. He works with a lot of young people around the same issue, but then also bringing those voices to the city council, to the Capitol, to ensure decision makers that they aren't negatively impacting somebody's religion by including hookah in their policy, that they can talk about the cultural impacts of hookah and then the health impacts on their own community. So that is not me as the white lady talking about, oh, you need to leave hookah in because, well, it's bad for health, blah, blah, blah. But that is the community themselves saying, this is not my religion. It may be something that my culture uses more often, but it has huge impacts on our health, and we should not be left out of this policy. We have seen elsewhere across the country, most state level policies and a lot of local policies have exempted flavored shisha from their flavor policies. The state of California, city of Denver, I can name a whole handful, and we do not want that to happen here in Minnesota. So that's my lens, but we certainly also talk about hookah use and shisha and our multi-unit housing work. But like Jeannie alluded to, our smoke-free housing team, well, some of them are on, although we can talk about that offline, and I would love to partner and connect on this work, and we can talk more in depthly about what we're doing and what we're seeing.
Great. Yeah, I'll email you. Thank you.
Yeah, I should share with you the photo of there was a hookah shop in the East Metro where we're working on a policy on I think I can't remember its flavors. Anyway, it was a local tobacco policy. And this hookah shop we knew was not a great community member. They had a big reader board sign out front that said Ramadan special, 50% off shisha. And boy, did we use that with our East African community members to say this is so much cultural appropriation. It's not even funny. And this is not a part of Islam by any means. So yeah, it's rampant still, but we're trying to get out of it.
Another follow-up in terms of the housing and research in that area is one of the barriers to smoke-free multi-unit housing has been the belief that if you have a smoking policy, that it will lead to excessive people being kicked out of housing, evictions. And there's pretty firmly held belief that if you have a good and well-enforced tobacco or smoke policy, people will be evicted. There's no evidence to show that that's true or not true. We don't think it's true. Our lived experience is that it's not true. We have no data. And that's a problem. When HUD made all of their multi-unit housing, their group multi-unit housing smoke-free a few years ago, they put no money into evaluation or research, zero. And that's the point at which it should have been done and wasn't done. So if there's anybody on this call who says, gee, this is of interest to me, I'd like to look at that. We have no data, but it's a barrier policy. And so what it means is low-income people, people of color, families who are most likely to live in multi-unit housing have fewer protections than they deserve.
Yeah, thank you so much. Any other questions from the audience? I can quickly ask. I have a couple, but I'll just limit it to one with the time. So I think Emily, or maybe it was you, Molly, that mentioned back when you were talking about some of the place-based restrictions. I think it was on flavor versus a full ban. You were talking about unintended consequences, and I would just love to hear about what those are. And I think it's so important to track, and like this is why the data is important, evaluation. So I would love to know what those unintended consequences look like.
Yeah, for sure. And one big one that I'll get to. So, like I mentioned, Minneapolis and St. Paul were the first communities to address flavored tobacco at all. Initially, we went to both of those cities with a policy that just restricted fruit and candy flavored products to adult-only shops. Eventually, we came back and added menthol, but it was the same policy to adult-only tobacco shops. What we saw in both cities, but more in Minneapolis, I would say, was a proliferation of convenience stores splitting their physical space with a cheap wall so that they could get 2 tobacco licenses. One that was a tobacco only shop that would allow them to sell flavors, and the other was their convenience store that would still allow them to sell soda, candy, bread, milk, etc. In Minnesota, by state law, if you're a tobacco only shop, you have to derive 90% of your revenue from tobacco or tobacco related products. This would exclude you from being able to sell that chips, candy, soda pop that convenience stores rely on. So, like I said, we saw the holidays in the Super Americas put up walls, apply for a second tobacco license, and say this side is our tobacco only store, this side is our convenience store. Obviously went against the intent of the ordinance for us as public health people and for the council members as decision makers. They didn't want to increase the number of tobacco vendors in their community, but that's exactly what happened because the industry saw a loophole and jumped on it. So part of the fix was not going back to that city and saying you need to do a full prohibition. It wasn't going to happen politically. Instead, we had them update their definition of what a tobacco product store was. That 90% threshold remained, but then we added a provision that said it has to have an exterior door. It has to have it can't share walls with another tobacco vendor. But that was only a lesson we could learn after the fact. We've continued to implement that language. But again, we know that the best policy is a comprehensive policy from what we learned there too. And I think our general message is like anything you leave out, the tobacco industry is going to jump on. They're gonna blow that up. If you leave out hookah, if you leave out chewing tobacco, they're going to say, oh, that's our product now. We're gonna put lots of money into selling that because we can. So comprehensive best so that the tobacco industry doesn't have any wiggle room.
Another unintended consequence is as soon as people invested in opening a new tobacco shop. They put their money, their life savings, their future into opening this little store. And I can tell you the politicians are very reluctant to say, we said you could do that, but we just changed our mind. So Emily has worked most in the city of Minneapolis, and I've worked primarily in the city of St. Paul. Both of us say there's no possibility of going back to those city councils and saying, we were wrong last time. How about we prohibit the sale of flavors in the city for everybody? We cannot, they will not politically do that. So our mistake, now we live with essentially forever until it's changed at the state or federal level.
Okay.
Yeah, you had that one opportunity, but
We had that chance, and I wouldn't say we blew it. We learned from it.
exactly.
It's pretty unfortunate that we learned on it with the two biggest communities in the state, but we did, because they were territories that where we knew the politicians. We had worked with them. We had lots of community partners, lots of community support. That's why we started there. It's really too bad we didn't start in Shoreview.
Yeah. I know we're over time, but one thing we learned and haven't figured out yet is which city the tobacco industry will sue. They sued neither St. Paul or Minneapolis. We waited until midnight after that Minneapolis ordinance went into effect, expecting a lawsuit to drop. It didn't come. They instead sued the city of Edina, which wasn't even, it was one of the first, but not near the first, not the first city to adopt a full flavor ordinance. They sued, it went to district court. Edina eventually prevailed. And to their credit, they implemented their policy during the lawsuit. Again, we haven't quite figured out the industry's goal. Who will they sue?
Sure. Wow. Well, just thank you so much, everyone, from ANSR for joining us today. There seems to just be a greater buzz and enthusiasm for this talk than what I think is typical. And I think it just speaks to the work and the impact that you folks are doing. And it sounds like there's a lot of kind of follow-up threads that may happen. And we just hope to keep connected with you. And everyone, thank you for joining today. And if we don't see you, have a happy new year. Thank you.